So the two goals are WHO or World Health Organization oriented goals. And I think you never get anywhere without goals. So it's amazing that we have a federal health minister that recognizes the importance of HIV and Hep C and has set those goals for us. I think one of the main challenges of whether they're realistic or not in Canada, one of the challenges is that we have a federalist system and provincial implementation. And each of our provinces has their own unique strengths and challenges to implementing anything at a provincial level. With respect to the HIV question, I think we're further along than we are with the hepatitis C question for sure. So 90% diagnosed, 90% on treatment, 90% undetectable. I think we might be able to get there, but I think knowing how close we are is challenging, given that there are multiple provinces without a provincial registry to be able to tell you that sort of information. So we don't have national registries about hepatitis C, treatment registries that are helpful. And that's a bit of a challenge. And in particular, in some provinces, we're still seeing lots of new infections with HIV, and that's going to be a bit of a regional challenge. Sometimes on the prairies, things are a little more challenging as well. With hepatitis C, eradication by 2030. Whew, that's a big one. Elimination by 2030, I think we could get on that. I think to do it, this is an infection that doesn't have a vaccine. And what that means is that to prevent people from getting new infections or reinfections, you've got to treat a high enough percentage of the population at about the same time that transmission stops. And for that to happen, we're going to have to figure out not just the cost of bringing costs down of drugs, but also more innovative ways of procuring drugs that really make it possible to treat a lot of people at the same time. So the second one for Hep C, eradication by 2030, which is no evidence of the disease at all. I think eradication is going to be tough. Elimination, so bringing it down to a level where it's almost undetectable, I think we could get there if we really put our minds to it and get all those community-based people we talked about earlier involved.
Well, when you look at 90-90-90, there's the 10-10-10 that isn't talked about. And we believe in the Indigenous world, or many of us, that the 10-10-10 is representative of our community, and that the initiatives and the funding to support what needs to be done in community to reach the 10-10-10 is not being supported adequately, and in some places at all.
So we've seen the political will, which is a first step, and we didn't have it before, so I'm heartened by that. But it doesn't just happen by itself. You've got to take that political will and you've got to do something with it. And what Canada needs to do absolutely is have a well-developed national action plan for addressing, ideally, I would say each disease specifically, because they're not the same. If we have to roll them all together and have Hep C combined with other sexually transmitted infections and bloodborne infections, that's okay. But I would prefer it if there was a Hep C plan, an HIV plan, a Hep B plan, because each one affects different populations. There are nuances to how you approach the challenge of addressing these conditions. And at least so far, there's been a lot of resistance from the federal government about developing a national action plan. And I can tell you, even with one, it's very difficult to achieve these lofty goals of eradicating this as a public health problem. Without a national action plan, forget it.